Okay, so I'm gonna go ahead and check the MAR against the provider orders. So I see that he needs his metoprolol today and his Lantus. So I'll just make sure it's for Dennis. Going to be doing Lantus, 17 units. It's going to be subcutaneous injection daily at 9 a.m. So it's 8:15. So I need to give it, or at least I can give it is 8:30. And then metoprolol, going to be 50 milligram oral tablet, 8 o'clock. So I can do it in the next 15 minutes, give this metoprolol. So then I'm going to check the provider orders, make sure metoprolol. So I have the metoprolol, so it's right medication for the right patient, for Dennis, right dose 50 milligrams, right route by mouth, and the right time. So I can do it at 8:30, since it needs to be given at 8, so I can do it by then. And then I also need to give the glargine, insulin glargine. So it's for the right patient, Dennis, the right medication, insulin glargine, right dose 17 units, right route, subcutaneous injection, and the right time. Needs to be given by 9 o'clock, so I can give at 8:30. All right, so I'm gonna go ahead and gather my medications. And get a medicine cup, metoprolol, and insulin. I'm just going to check if it's the right patient for Dennis. Metoprolol, right medication, 50 milligrams, right dose. Right route, it's going to be an oral tablet. Right time, 8:17. It's not expired, so that's good. Cool. And then I have Lantus, which is insulin glargine, so it's the right patient for Dennis, right medication. I only need 17 units, but this has 100 units in the vial, so I'm good there. It's going to be a subcutaneous injection. So this is a vial, and then the right time, let's do it at 9. So it's 8:18 right now, so I can give that at 8:30. It's not expired, and it's clear. There's no precipitates, so it's looking good. Okay, I'm just going to grab my supplies. Cup of water. Okay, I'm just going to perform hand hygiene before I draw up the medication. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Okay, I'm going to let that dry. I'm going to draw back to 17. Inject the air. And put back. Okay, what do I have here?
That looks like 17 units of Lantus.
Okay, perfect. Another alcohol swab for the patient before I go into the room. Okay, and then just trying to put the metoprolol in the next cup for the patient. Okay, so I have all my supplies. I'm going to go to the patient's bedside. Perform hygiene before entering the patient's room. Good morning, my name is Elise. I'm going to be your nurse today. Have your morning medications. Can I have you verify your first and last name for me?
Yes, it's Dennis Zotny.
And your date of birth.
09/02/59.
Okay, and do you have any allergies to medications?
No.
Okay, wonderful. So I have 2 medications for you today. I have your metoprolol and your Lantus. Your metoprolol is going to be for your heart failure. So what it's going to do is it's just going to help lower your blood pressure. So some side effects with this is it's going to, it could cause lower than necessary blood pressure, like no lower than we'd like it, and lower heart rate. So if you start feeling dizzy or lightheaded, or when you go ahead and press your call light. And then we also have your Lantus, and that's for your diabetes. So some side effects with that is going to be lower blood pressure. So if you start feeling lower blood sugar, so if you start feeling kind of fatigued, cold, and clammy, I want you to go ahead and press that call light so we can come and check on you, okay?
Okay.
So I'm going to give you your metoprolol first. So I'm going to go ahead and check, make sure I have the right medication, metoprolol. The right dose, it's the 50 milligrams, the right patient, which is Dennis Zotny, right route, it's going to be an oral tablet, and the right time, give it by 8:30, and it's 8:21 right now, so I can go ahead and give that. So I'm going to just scan the patient's barcode, and then scan the medication. Everything's looking good, and I'm administering it right now at 8:21. Okay, Dennis, here's your metoprolol, and here's some water to take with that.
Thank
Awesome,
you.
great job. I made sure that you swallowed. And then I'm gonna go ahead and give his insulin. So we're gonna make sure I have the Lantus, so it's the right medication, the right dose, 17 units. I have 17 units here. It's the right route. We're gonna do subcutaneous injection, the right time, given at 9 a.m. and it's 8:22 right now. So we'll have to wait until 8:30, but for the sake of the sim, I will just say that it is 8:30. But I'll go ahead and prepare for the injection. So I'm going to ensure privacy for my patient. I'm going to put him at the right height for me. Just going to put you up a little bit, Dennis, so for the medication injection for your insulin. All right. I'm going to scan the medication in first. So I'm going to go into the MAR and make sure that I'm scanning in the right medication. So right patient, I'm going to scan the barcode here, and the right medication, scan the barcode there. Okay, perfect. So right patient, Dennis Zotny, right medication, you have the Lantus, the right dose, we have the 17 units here, right route, subcutaneous injection, the right time. It's supposed to be injected at 9 o'clock. For the sake, we're just going to say that it is 8:30, but the time on here says it's 8:24. Alrighty. So I'm going to put on my gloves before injecting. And make sure that I'm at least 2 inches away from the umbilicus. Make sure that area is dry, but it won't dry on the mannequin. It's going to pinch, 90 degree, inject, hold. hold 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Alrighty. Okay, I'm going to dispose of this in our sharps container over here. Throw away the rest of my supplies. Hand hygiene. All right, Dennis. You have a great rest of your morning. I'm just gonna go ahead and lower the bed. Make sure that the bed is locked, well positioned. You have your cot light over here on your left-hand side, and then I'll just go ahead and put your side rails up. Make sure you have both side rails up for safety. You can pretend that it's just the two and this is not a restraint. And you have a great rest of your morning. I'm gonna go ahead and document. And once again, if you do start feeling lightheaded, dizzy, fatigued, cold and clammy, go ahead and press those call lights and I'll check back up on you, okay?
Okay, thank you.
You have a great rest of your day, Dennis.
You too.